Welcome to the National Organization of Nurse Practitioner Faculties podcast.
Welcome to the second series of the NONPF podcast, created by the Simulation Committee of NONPF. This year, our podcast series, titled In the Trenches, Confessions and Pearls of NP Simulationists, will center around the 2023 fall release of the NONPF Guide to Nurse Practitioner Simulations, a step-by-step approach. This guide, an e-learning book, was created by the NONPF Simulation Committee. The ebook is formatted to help NP faculty design effective, measurable simulations that address learner programmatic and national level competencies. Led by members of the current Simulation Committee, podcast moderators invite authors of the ebook to share pearls of approaching simulation from the perspective of the nurse practitioner. Hello, and welcome to the next podcast in our second podcast series. Today we're going to be focusing and talking about virtual simulation. So I'd like to welcome our guest speaker, Dr. Kristen Brown, but first I'll introduce myself. I am one of the co-moderators today, and all three of us, I should say, are members of the NONPF Simulation Committee. I'm Jeannie O'Rourke. I'm an associate professor at Loyola University in Chicago. Leanne is my co-moderator today. Leanne?
Leanne Barfield, and I'm an associate clinical professor at Florida State University in Tallahassee, Florida.
Great, thank you. And our guest today is Dr. Kristen Brown. She is the lead author on the virtual simulation ebook chapter. Welcome, Dr. Brown. Do you want to introduce yourself?
Great, thank you. And Leanne and Jenny, thank you for having me today. I'm Kristen Brown. I'm associate professor at Johns Hopkins School of Nursing, and I'm also the interim associate dean for simulation and immersive learning. So thank you again for having me. I'm excited to talk about this chapter.
Yes, so are we. So let's start by defining virtual simulation. Because I think, some of us feel like we know what that is, but maybe we don't really know what that is. And the ebook has lots of different types of what virtual simulation is. So help us clean this up and clarify. What is virtual simulation? And give us some examples.
Right. Thank you for that question. I think it's really important to think about terminology. Right now, we're at this point in time where there's all these terms. And when we started this chapter a while back, we were kind of going, okay, virtual sim, we're from a distance, this is what we're doing. And now it seems like we're embracing distance simulation a bit more. And we do cover that definition in the book chapter as well. Currently, the Society for Simulation Healthcare has a Distance Sim Collaborative, which I'm part of, and we're really trying to work towards having some unifying terminology, especially for distance simulation and simulation in general. I think it's much easier for us as educators to be able to find the resources or find current literature if we know what terminology to look for. Right now, there's a lot, from telesim to virtual to distance. So there's not a current one kind of umbrella term that we're using, but I would like to use the Healthcare Simulation Dictionary from the Society for Simulation Healthcare and the AHRQ. They update that, and that's really my gold standard. In the chapter, though, we cover different terminology, but also we cover terminology of other sim elements that we use from a distance. So we might talk about what a standardized patient is versus an objective structured clinical examination, because these are things that you will utilize from a distance potentially. And then we talk about, screen-based simulation versus virtual reality. What is virtual reality? Where you're in a whole different world. And so you have a headset on with hand haptics and you're fully immersed. So again, there's different modalities that you can use for distance or virtual learning. And so we try to define them and also the terms that go along with it.
Another great thing that the chapter includes is, how to use the Kearns process for aligning virtual sim to course design and curriculum. So could you briefly walk us through that, Kristen?
Yeah, and I think, the chapter hopefully does a really good job, especially for if you're a novice NP educator or even an experienced NP educator and you understand curriculum development. We're really trying to talk about, if you're doing things from a distance in simulation, that you still need to look at these kind of stages of curriculum development. And it's interesting because they align very closely with the standards of best practice in simulation that were set forth by NACSL. And so again, we kind of walk through in the chapter, how do you look at a problem and where is your problem in a curriculum or maybe gaps, and how is it going to be supported? Or how do you use distance or virtual simulation to help support that? Also, looking at a targeted needs assessment. Are you doing curricular mapping? Is this something in your curriculum that you're using to fill the gap? And is it also going to meet a competency that you are looking to achieve? And one of the 6 steps is obviously always goals and objectives. Well, of course, that's one of the main things that we look at in the standards of best practice. So does this goal of this simulation, does this meet either the course objective and also go back to the main curricular objectives in your program? So I think in the chapter, we really tried, and I think throughout the book, to talk about how you incorporate these things into your curriculum when you're using simulation.
Exactly. Yeah, the book it really starts with course design, and so then it flows through, and we revisit it in the virtual simulation chapter around the context of virtual simulation. So I think the chapter does really give that that nuanced approach for if you're thinking about virtual. And I'll just put a plug in because I'm hearing this probably in all of the podcasts we're going to be doing this. This series is, aligning back to your AACN competencies. We're all kind of knee deep in that right now. And virtual simulation is certainly, hopefully, part of that map you're doing. So this chapter, I think, would be helpful in some of that work. Can you talk a little bit about something, specifically around virtual simulation and thinking about logistics and operations for running a virtual sim, and how that might look a little bit different than maybe a traditional high fidelity?
Yeah, and I think it's a great question because I think as we're embracing more technology, and I think it's important to think about why we're doing it. And we're doing it so we can do sim more often, and we can do it from a distance. And you don't have to have people come in to a site to do a massive event. And especially in NP education, we know it's difficult. It requires a lot of resources, time, effort. I'm not an advocate to replace in-person sim. I think there's a place for it, and I love it. And I love to touch, feel. There's things that you can't replace from a distance. But you can't do it that often. Maybe you do that once a year or once a semester, or maybe some programs you just do it once in the entire program. So I was always looking for modalities to support simulation, repetitive simulation. And so distance is a great opportunity. That's a great opportunity in NP education. So when you think about this, and again, it goes to those like curriculum development things you're thinking about and standards of best practice, you have to really be mindful of the operations piece before you go into it. Do you have the support? Do you have the buy-in? And it really depends on the technology you're using, but also how are you getting this information to the end users? And the end users are not just the students, it's to the faculty as well. So when I think about the operations point, I think from the sim team, or if you are an educator looking at this, how can you utilize your simulation team to help you? Because I think of this as just another modality of simulation, but delivery. So the operations, you have to make sure that, is this something that the students require a different computer, or is this something that the faculty requires something different? It's really important to think about when you're trying to figure out what type of technology you may use, because you may not have buy-in if it's going to be something that's going to be a burden or a cost burden to the student or to the school. And I think it's really important to think about the big picture all across the curriculums, and specific to NP education, we all do things a little bit different depending on our specialty. So you really want to look for something and develop something that can be utilized through adult gero, primary care, adult gero acute care, primary care NP, all of these programs. And so you're going to have more buy-in if you get people to collaborate across the programs to implement this. So the operations is key, but also thinking about the elements that are best practice, pre-brief, debrief, and how you're going to approach this. And sim operations is really important because you have to educate the user how to do it ahead of time. before the brief. How are they going to do this technology? And then it's really important to incorporate an orientation to the environment. And the environment does look very different than in person with the high fidelity mannequin, like you mentioned, Jenny. So how are you going to orient them to this, whether it's a video, whether it's practicing ahead of time? So again, we cover some of this in the chapter about just thinking about aligning those things to this new modality.
Well, that's a great way to give us the information on the differences that virtual sim brings, all the way through inception to debriefs. But I'm thinking about how can faculty evaluate the effectiveness of the virtual sim, and are there unique things that faculty need to consider when they're doing this evaluation?
Yeah, and I think it's twofold. I think anytime you do something new, there needs to be a comprehensive evaluation of, is this delivering what we need, aside from evaluating the students? So I think these are two big pieces of the puzzle. With every simulation, there should be always a post-sim evaluation. I think it's crucial to make sure that this was achieving what you set out to do. There's a lot of validated tools out there that you can implement. I've done a couple studies with my colleagues here, and looking at these tools and their post-sim evaluations, because I want to collect this data from the students. I want to make sure that this is worthwhile. There's a system usability scale. This is something to just show usability. Is this actually usable? Was it really hard and cumbersome, and did the learners find it very difficult to use? Then maybe I need to pivot and do something different. Also, I use the SET-M tool a lot, developed by Kim Layton, and that's looking at pre-brief, simulation, and debrief. And those are, again, my most important elements, whether I'm doing distance sim or in person. So again, you can continue using similar tools that you have, but there are some adaptions and different tools for distance learning as well. So again, it's very important. But then I think there's a programmatic assessment that needs to happen. You as a collective group of faculty need to reevaluate and say, is this still working for us? Has this been updated, or is this getting stale? Is this still what we want to do? Is it still meeting our learning objectives or curricular objectives as well?
So I think we could talk all day about virtual simulation, right? We're all passionate about that, but we can't. So I'm going to ask just kind of a wrap-up question and bring us back to the ebook. And really, this particular chapter has some almost like templates on how to implement the virtual simulation, which are great resources. So Kristen, can you just end by talking about like how someone might use this resource, but also all of the resources that NONPF has for simulation?
Yeah, and I think it's great because I think the book does a really good job of providing exemplars. I think exemplars are great to use, whether you are a novice or an advanced provider or educator, and you just want to try something new. So we tried to give really templates for exemplars. And I think, and also it's an ebook, so there's active links to things like tools. And it's, to me, that's how we're going to be reading books in the future, like active links that you can actually get to the information. So I think NONPF in general has done a really good job of embracing simulation from our simulation committee, but also we have the simulation portal, again, with active links that we update. We also developed the standards of best practice for MP education based on the NACSL Sim standards. Again, another great resource. And it's not reinventing the wheel. I mean, the best practice or best practice, but how does this relate to MP education? What are the things that we need to know? And so the book also is very specific to MP education, which I think is, we have a different set of things that are really important to us. And we don't fit the mold of general pre-licensure nursing, where one mold, it fits everything. It's just one curriculum. We may have, one school might have 6, 7, 8, 9 different curriculums, depending upon your advanced practice program. So I have to really commend NONPF leadership for really embracing simulation and providing the tools to our to our members, because I do think it's been really well thought out. And I think this book is just another example.
Great.
Good point.
Well, I think we will end on that today. I just want to thank Dr. Kristen Brown for joining us today, and my co-moderator, Leanne Barfield. Thank you so much. We're happy to have conversation, and I'll look for additional podcasts. Thank you so much.
Thank you. Thanks
everyone.
for having me.
Thank you for joining us today to hear from our NONPF simulation experts. This podcast has been written, directed, and produced by David House, Jenny O'Rourke, Elaine Kauschinger, Tedra Smith, Jeannie Rodriguez, Leanne Barfield, and Queen Henry-Okafor. Special thanks to NONPF CEO Mary Beth Bigley. The digital ebook is available for purchase on the NONPF website to both members and non-members. The opinions expressed in this podcast series or any product mentioned are not specifically endorsed by NONPF.